Myself, Dr. Ramesh. So today I'll be discussing on diabetic gastroparesis and its treatment. First of all, good morning to all. So the diabetes, type 2 diabetes, which we commonly encounter, which can mainly affect the nervous system. So like peripheral nervous system, which affects sensory fibers first, followed by initially it may affect small sensory fibers, followed by large fibers. The same way, this can affect the nerves which are involved in gastric motility. So, and for the discussion, my topic for today is diabetic gastroparesis and its treatment. So, the diabetic gastroparesis, which occurs mainly due to uncontrolled sugars. Mainly here, the problem is the emptying of the stomach and intestine. So, the peristaltic motility of the stomach and intestine will go down. That leads to the gastroparesis. So this diabetic gastroparesis mainly causes nausea, vomiting, abdominal discomfort, abdominal distension. So this mainly occurs due to damage of the nerves which are involved in peristaltic motility of the bowels. That is mainly stomach and small intestine. So this the main cause for this is uncontrolled sugars and longer duration of the sugars that leads to this gastroparesis. The main treatment for this is controlling the sugars and when strict control of the sugars from the beginning. So some dietary changes can help in preventing or prolonging this gastroparesis. One is high fiber food with low fat and cholesterol, and small quantity meals in higher frequencies. That helps in digesting and fluctuation. I mean, the glycemic variability will be controlled with changes in dietary habits and strict sugar control. So, for strict sugar control, a low carbohydrate diet, low high protein diet, and low fiber diet, and following the advice of the physician or diabetologist, prescribed insulins or diabetic medication, that is oral hypoglycemic agents or whatever it is, following the strict advice from the diabetologist or a physician. And there are some drugs which can increase the motility of stomach and intestine. That is mainly some group of antiemetics, metoclopramide and domperidone, which can improve the motility of the stomach and intestine. And there are some other 5-4 agonists, etopride, which can improve motility. And recently we are using levosulfide, which is an antipsychotic also. That also helps in the motility of the intestine. That will improve the bowel motility, which can prevent gastroparesis and which can reduce the symptoms like nausea and vomitings. And recently, botulinum injections, which can be given directly into the muscles of stomach and smooth muscles of this stomach and intestine. Even that can aggravate the motility, which can help in preventing the gastroparesis. And gastric electrical motility stimulant machines, which are in research, may help in improving the movements of the peristalsis of the intestines. That also can help in preventing this gastroparesis. In some patients, stress control, and that also will improve the gastroparesis and motility issues. And sometimes taking high fiber food, low calorie diets, low carbohydrate diets also helps in the gastric motility disorders. And protein, I mean, malnutrition and low protein diet, this also will aggravate. So we should prevent this and give nutritious products. Will improve the gastroparesis issues. And in the recent advances, gastric motility, the equipment which aggravate the gastric motility, like GES equipments, which can which can improve gastroparesis. And it all begins where once the patient has diagnosed with diabetes. So it is if you can control the sugar once the patient diagnosed, keeping regular control, regular follow up, or keeping the sugars within limits. So all will help preventing the sugar affecting the nerves, which are mainly involved in gastric motility. And sometimes we need to monitor. So monitoring gastric motility directly is difficult. So we need to follow peripheral neuropathy majority of. If some patient is developing peripheral neuropathy, majority of the times small fiber sensory nerves are involved. So once you are seeing patient complaining diabetic neuropathy, that is peripheral neuropathy, mainly affecting small fiber. So we can estimate that other organs, I mean, other nervous system, other parasympathetic nervous system, which are involved in gastric motility disorders, will be affecting. So at least at that time, we need to improve the monitoring and strict control and frequent follow-ups to the diabetologist may help. And when it comes to dietary habits, as I told, low carbohydrate diet, high fiber diet will help in gastric motility. We should advise patients not to sleep immediately after, which can cause regurgitation and which may affect the gastroesophageal sphincter. And one more thing is weight loss. So weight gain will affect gastroesophageal junctions and can cause flux and motility disorders and strict treatment. So for obese patients, we advise metformin. And if patient is very much uncontrolled, it's better to go for insulins along with the combination of metformin and other oral hypoglycemic agent. And we should counsel the patient regarding the complications which can occur after 1 year, which complications we are expecting, after 5 years, which complications we are expecting. So that's how. And we should educate the patient regarding the symptoms of the gastroparesis. That mainly what we are seeing, that is bloating, distension, constipation. We should educate the patient regarding the complication. Majority of the patients are worried about this peripheral neuropathy and diabetic nephropathy, retinopathy, and majority of the people are not concerned with gastroparesis, which is part and parcel of the nervous involvement of the diabetes, and which will adds morbidity to the patient. So where gastroparesis is severe, patient may not tolerate oral hypoglycemic agents, and which will causes uncontrolled sugars. Again, that can affect his that can cause again aggravating the gastroparesis, and that becomes a vicious cycle. We are little not worried about this gastroparesis, but this will cause more morbidity and preventing patient from tolerating these oral hypoglycemic agents. And majority of the times, the patients are intolerant to metformin. Those who are gastroparetic, they may face more symptoms than others. So that leads to again uncontrolled sugars. That will cause more gastroparesis, and this becomes a vicious cycle gradually. So since beginning, once you are seeing the patient, once the patient is diagnosed with diabetes, along with this nephropathy, retinopathy, and neuropathy, we should educate patient regarding gastroparesis and its complication. So even when it comes to treatment, we should be monitored and we should be asking patient about the symptoms of this gastroparesis, like bloating, symptoms of reflux. Then better consider adding this prokinetics 5-HT3 antagonists or 5-HT4 agonists, which are available in the market, along with the basic antacid. So that helps in improving the motility of the bowel, so which will reduce gastroparesis and increases adherence of the drugs and increases compliance of the oral hypoglycemics with patient. Otherwise, what we think is, so we are giving some dose should come down, but majority of the times we don't see proper control of the sugars. And once you are seeing gastroparesis, that itself indicates there is involvement of autonomic nervous system. So their cardiac complications. So gives us a clue that a patient is developing autonomic nervous involvement, which can affect the cardiovascular system. So that also we have to consider. And mainly dietary habits we should, that is low fiber diet, sorry, high fiber diet, low carbohydrate diet, and taking meals in increasing frequency in small quantity meals. That also helps. And lifestyle body, regular physical act, and quality sleep, and avoiding stress life. That also helps. If gastroparesis is severe, then we can advise this botulinum injections and the equipment, gastric electric stimulator, which can improve. And with that, the other ends of the patient with the oral hypoglycemic agents will improve. And we should look into the other causes which are causing gastric motility issues, and we can there are some drugs which will affect gastric motility. So that also we need to monitor, and we are finding any drugs which are affecting the gastric motility. We should reduce the. So sometimes we need to go for modern techniques like gastric motility stimulator treatment or botulinum injections, which can help in these gastric motility disorders and gastroparesis issues.